Assalamu alaikum wa rahmatullahi wa barakatuhu. You are watching Sisters Corner, and again, Uzma Khan with you. I have a lovely guest, Samar. With Samar, we are discussing a lot of issues ladies, sisters are facing at the moment, and a lot of information she is giving us as a gynecologist, and I'm very thankful for you to have you in my program today.
Thank you
honestly.
again, Uzma.
And Samar is working in Mede Hospital as well as a gynecologist, and she's working in Palime Medical Hospital as well. A lot of ladies, maybe they know you already. Oh. So it's good to share the information. We have discussed about polycystic ovaries, we have discussed about fibroids, we have discussed about polyps, we are discussing about smear tests, we have discussed about teenage issues and their early special days as well, and we are now going to discuss more about cervical screening, what it is and why it's very important for the ladies to have and go every 3 years or regularly if you're having an issue. So what is cervical screening and why it is very important for ladies?
Cervical screening means that you go to your GP or local nurse and you do a smear test at the GP. Mm-hmm. They do an internal examination with a speculum, mm-hmm. and they do brush of cells from the cervix. Mm-hmm. And it is done from the age of 25, mm-hmm. Every 3 years until you are 49, mm-hmm. and every 5 years until you are 64. Mm-hmm. And by doing cervical screening, the reduction of cervical cancer, mm-hmm. is reduced by more than 85%, mm-hmm. because you detect early, you prevent, and you treat early.
That's brilliant.
Yeah.
So what are the early signs you can see doing by cervical screening?
So you do cervical screening, you look for abnormal cells, you look for infection. It's mainly caused by infection, mm-hmm. and it is a virus called HPV, which can cause precancerous cells. Mm-hmm. This is what we look at the cervical smears. Mm-hmm. We look at the precancerous cells and we offer treatment, mm-hmm. or we offer a follow-up to make sure that the virus has gone, the body immune system has fought it.
So what do you think, what could be the cause? I don't know if maybe I'm just going in so a depth, and maybe it has been researched so far or not. So what is the reason of this virus, and how can we protect from this virus so the ladies can, they can save their life, honestly?
What we know so far is virus like any virus. Like, yeah. You have influenza, it is a virus. Yeah. Viruses you can't, so far our knowledge is that we can't protect so far from it. Mm-hmm. You have the vaccine for influenza, mm-hmm. every year. Yeah. You have the jab as a teenager to protect for the virus. Mm-hmm. You as a Muslim woman, you protect yourself because you are with one partner, with husband, and you do like a relationship that, mm-hmm. you don't have multiple partners. Yeah. So this help you to protect.
Mm-hmm. That's very good, actually, to know.
Yeah. Wearing condoms, if there is a discharge or infection, can protect you from having a virus like that. Then by screening, you protect yourself. Mm-hmm. You know that if there is an infection, if there is a problem, mm-hmm. it has to be acted on. And also you don't blame on one person, mm-hmm. because as I say, that viruses, mm-hmm. are they come from nowhere. So yeah.
Yeah. Okay. Obviously, a lot of ladies watching my program, sorry about sisters if you say something is wrong, but obviously, how important is it, personal hygiene? And a lot of ladies, they do not actually look after themselves properly and going through, taking bath every day, or washing themselves with the soap and these sort of things. And how important is it for ladies especially to be clean, personal hygiene?
So personal hygiene, especially around your private area, basically, like we always advise not to remove all the hair, because the hair acts as protective as well. So you can't trim the hair, because sometimes people remove the hair and they have abscesses, you have infection because of that.
That's very important. I didn't know that. Yes.
Also, some people think that cleaning has to clean with water and soap down below. You shouldn't use anything harsh to your skin, because it's very sensitive area. So just water, and always dab it dry. Dry, or use a hair dryer to dry. This is as simple as that. Some people have sensitive skin, so always use moisturizer that is has no odor, like for sensitive skin. Maybe once a day or once every other day, and leave it to dry in the skin. This simple thing. Bath, I wouldn't, like, I'm not too fan of bath, because bath change your pH of the vagina. It can predispose to infection. People sometimes do douches as well, and they think this is cleanliness, but this actually disturb the pH of the vagina. So just external wash with water and dab it dry, and cotton underwear. This is the best thing. If like young girls who wear tights, very thin synthetic clothes, they always have like damage to skin or allergy or dermatitis. So as simple, as easy as cheap. I read actually one of the article which was saying it's important for ladies to have like cotton, especially undergarments should be cotton ones. Yes.
Why it is like, what do you think, why it's important?
It is because it is like the contact with cotton to the skin is really mild.
Good for sensitive.
While if you have like thin synthetic underwear or even the sanitary pads, like has to be cotton. Some of them are plastic. They cause contact to the skin and they cause inflammation to the skin. So it's a very delicate area. Has to be treated very delicately and very carefully.
How do you think how often the ladies should be taking bath? Or
I would say that shower is the best, and no soap down below. Water, rinse with water and dab it dry. Shower, and maybe you take a bath once a week. Shower every day, and a bath maybe once a week, like to treat yourself.
That's very important. Personal hygiene, obviously, this is how Allah subhanahu wa ta'ala has said as well that cleaning is half of your iman. It's not only the cleaning of your body, your heart, but you obviously yourself, your character as well. But taking bath regularly, keeping yourself clean, putting on nice clothes, using a good smell is very important for ladies as well inside the home. So
I like that.
So when we talk about obviously personal hygiene, and then we go ahead with pregnancy, a lot of women, they cannot conceive as well. First of all, I will talk about fertility, and then I'll go towards pregnancy.
So we always say that natural things happen naturally. Just you have to not to rush. In my clinic, I have people coming after 2 months. Why I'm not pregnant? You have to give it a year at least to seek help. And as I say, you have to diagnose early. If there is a polycystic ovary, you have to treat it. If there is a problem, you have to treat infection. You have to treat it early. Don't leave things to happen by itself, and then you have a problem. Every couple, we tell them that you diet, exercise, avoid smoking, of course, alcohol. Muslims don't drink. And you have to have a BMI of around 29. This is to put you at the best chances of getting pregnant. When you have an intimate relation, maybe 2-3 times a week, that's enough. Overdoing it is not helpful, because The semen forms like the semen in the body forms every 3 months. So if you're doing intimate relation every day, this you are consuming too much and maybe not helping you when you are ovulating.
Okay.
So 2-3 times a week is enough.
Yeah.
And you seek help after a year of trying actively.
Yeah.
Yeah.
So, is there any trouble with, because I have seen many ladies, they have polycystic ovaries, they do have fibroids, but still they have children, they can get pregnant because, if we are discussing these things and a lot of ladies sitting at home, they must be scared or worried about we can't get pregnant or this is kind of fertility. But it's not the case. Because I've seen women getting pregnant with polycystic ovaries, getting pregnant with fibroids as well.
Because nature is great. So, and we don't know everything. But as I say, if you know that you have polycystic ovary, you are overweight, you still can get pregnant because nature is great. But after a year of trying and you have all of that, you need to seek help.
Yeah. So seek help at least stages, but not that early, like after 2 months, but at least give yourself a year.
Yeah, and also stress is a big problem, because it can affect all your body systems. You don't ovulate regularly, hormones and everything.
Blood circulation.
Just enjoy your life, take every step as a bonus and enjoy it. And you know that you have an end point, that if nothing happened naturally after a year, then you need to seek help.
Yeah. Again, if it's written, Science is science, but obviously you have to think about what Allah subhanahu wa ta'ala has written for you. It will come to you. But obviously, Allah subhanahu wa ta'ala has sent, the treatment for each and every illness as well. So it has to be treated if you have any illness. There is a treatment available and you have to seek help at the right time. It's not that only whatever is written that it's okay. But if you have like any sort of women's issue, seek help at the right time. So when we talk about pregnancy, a lot of things happens during the pregnancy, hormonal changes, stress, anxiety. Obviously only the women who is going through pregnancy can tell you how complicated it can be. But people in our surrounding, they do not know what the lady is going through. So what advice, first of all, you will give to the people who are around us and how they should be treating that woman who is pregnant?
Perfect. So a pregnant woman will be very emotional. She needs lots of love and care and support at home because they go through a lot. Every 3 months of pregnancy, they are totally different. Early pregnancy have the morning sickness, the vomiting, and some people lose too much weight in early pregnancy. And they need to even little things can initiate these symptoms. So we have to be caring about your partner that they are pregnant and see what they like and little food that they can keep in their stomach. Not every food, so you have to support them and give them what they want. Second part of the pregnancy, they start feeling comfortable, but blood pressure can go high, they can have fibroid, which can give them pain, so other things. In the late pregnancy, the baby they can develop diabetes, they can develop preeclampsia. So every part of pregnancy can be associated with problems, but I don't scare everyone because 80% of pregnant women will have no problems.
They are normal.
They are
normal ladies.
Absolutely.
So think positive. Just say go with the flow. It will be fine. Honestly.
But you have to care about the pregnant woman and make sure that you give her lots of support.
What is preeclampsia? Preeclampsia. When we talk about obviously and the third part of pregnancy, last 3 or 4 months is normally ladies are going through. What it is and how we can be prevented.
So preeclampsia, it happened because the placenta or the afterbirth doesn't form greatly, so the blood flow to the baby is not as perfect as it should be, and it will be associated with the protein in the body, that rather than it's kept in the blood, it goes into the what we call extracellular place, goes under the skin. So women lose too much protein in their urine, and their blood pressure will go high, and it can be associated with visual symptoms, can be associated with stomach pain, and can be associated with seizures in extremes. It affected the baby because, as we said, that the afterbirth is not like perfectly formed, so the baby can be small in size, and the water around the baby will be like reduced, and like if there is a seizure, the baby can be compromised as well. So detecting and making sure that you go to your antenatal appointment, you see your midwife, you see your doctor, you do the essential scans that are planned for you, and don't lose any of your appointment, because they are very very important, and it is because if you don't take pregnancy for granted, because anything can go at any time wrong.
What does it mean having a higher level of protein in your urine test during the pregnancy? Obviously, we have discussed, but I would like to go in detail because sometimes we don't know the food we are having during the pregnancy could be one of the cause to have more protein, or it's not.
It's not. No, it is the high protein. It is, as I say, like it is due to the placenta is not formed well, and the balance between the enzymes and body functions are not great. So you lose protein because your kidney is not working effectively, and your blood pressure goes high because of that. It's not related to food, but always food we eat. We always like a healthy lifestyle. Don't take pregnancy that you need to eat to give the baby. It doesn't work like that. You eat healthy and vigilantly, because you can easily develop diabetes in pregnancy because of the hormones. You have lots of steroid in your body because of the hormonal changes in the pregnancy. So you are more prone to develop diabetes in pregnancy. So don't overeat, and be careful in your food, and make sure that you are not gaining too much weight in pregnancy.
Yeah, that's very important as well. When we go for first scan and second scan, obviously they see the fetal growth, and if it sometimes is very high, sometimes it's not properly, like it's lower than average. So what could be the cause of it, and how we can prevent? Again, we are talking about a lot of preventions because we have doctor in our forget today, and obviously it's important.
Yeah, so we have two extremes: either a very small baby or a very large baby. Yeah. So how to get the right baby? That's important. So if you some people have genetic predisposition to high blood pressure, and their blood pressure is not great in pregnancy. But we'll say for normal person, you should gain in pregnancy total 13 kgs. 13 to 14 kgs. Don't put on 30 kgs in pregnancy because you are pregnant, because all this go on to your body systems and affect your
body. Doesn't help the baby.
And goes to the baby as well. So if you develop diabetes in pregnancy, your baby will be too large, and that affect your pregnancy, and that affect your delivery. You may end up having cesarean section because your baby is too large. So again, how to have the perfect baby and perfect body.
That's very important.
So you have to be vigilant and watch yourself, because as I say, hormonal changes in pregnancy can make you your appetite will be too large, but you have to just stick to what you normally do. Don't overdo it.
Okay. When we obviously sisters watching the program. Obviously, this program, we are presenting it for the sisters sitting at home. I would like to discuss about, inducing the baby. Obviously, when the baby is too large and they go through, the pain relief and induce the baby early, then the perfect time. So what are the complications in that, or what can be, or is it okay, or how, again, we can prevent? Yeah.
Right. So the best thing that nature takes its course. So if you go in labor naturally, your pain is more tolerable. You're more likely to go in natural labor. But this is why you do your antenatal care. You go to the hospital because you need to prevent any complications that could potentially happen. So if, for example, you develop diabetes in pregnancy, you need to be induced earlier than your due date, because the placenta doesn't work perfect at the due date or after the due date. And there is a small risk of stillbirth. So sometimes you are obliged to go with the induction because it is preventing other major complication. Induction itself, it takes about 2 to 3 days. If this is your first pregnancy. If you've done it before, you delivered before, then induction will take about 1 day. We give hormonal pessary to stimulate the cervix to get soft, and then to stimulate the labor. It is not pleasant because you are will be at hospital waiting for things to happen. But as I say, it is done because there is a reason behind it, and we needed to prevent a complication that could happen if we waited for the natural labor to happen.
That's not good for the baby and the mother.
Yes.
Health as well. Very informative, honestly. All the sisters, I hope you're watching, and it is very good for you as well. And especially if you have experience, or you're going to have this kind of experience, at least you know what is going to be happening or what will happen, and what to do. So we will, discuss further in detail about, after the pregnancy, postnatal depression, and what it is after having the baby. Obviously, your world is now changed, yeah?
Yes.
So what it is, and how we can prevent.
Yeah. So many women, there is 2 types of changes that could happen after delivery. There is a postnatal blues, which because of the lack of sleep, hormonally changes, it happened in the first few days after delivery, maybe day 2, 3. Your body changing, your baby crying, you are not having a good sleep pattern, so you will feel stressed and things. But it does, it happen in lots of women, but it's self-resolving. Once you have a routine with the baby, and you're feeding the baby, and you're having a routine in your life, then you can sleep fine, and then it resolves. Postnatal depression is another thing that can happen on day 7 to 9, 10 later after delivery. And you feel the woman that is started to be withdrawn, and she's not having bonding with the baby, so she's not caring about the baby. Then it is alarming, and you have to raise alarm to the midwife and have a treatment for that, because it can be go wrong ways.
What are the reasons of postnatal depression? I have seen a lot of ladies going through postnatal depression these days, and people around them, they do not know what it is, and it's very important to look after that sister, that women in that condition. So please, if you could just briefly explain to us in a big way.
So we said that postnatal depression develop late, after day 9, 10 after delivery. It happens for people who had problem with mental health in the past. If they don't have a support at home, supporting partner, supporting family. Also, it goes in families that have depression or have mental health issues because of the lack of support. So a pregnant woman or a woman who gives birth, she needs lots of support from the family, friend and husband. And it can go depression. People have suicidal thoughts. So it has to be alarmed early, red flagged early and treated and raised to the GB or mental health team.
Well, very important. Thank you so much, Dr. Samar. Honestly, you won't believe like how many things I got clear in my head in today's show because of the information you have shared with us today. And I hope all the sisters watching IQRA TV, Sisters Corner, they have been very happy watching this program. Obviously, would you like to say anything to the audience before I say a finish line?
No, thank you very much for giving me the opportunity to be talking to a Muslim women through IQRA channel. And I'm happy for any questions or anything that comes through Uzma to answer it back.
Thank you so much once again, Dr. Samar. I'm very glad, honestly, to have you, and I'm feeling very honored to have you in my programs today.
Thank you very
and
much.
I would like to say, all the audience, thank you so much, all the sisters watching the program today. And keep watching IQRA TV. And next week and next program, I will come with another special guest. So stay tuned with us always. Till next program, Allah Hafiz.